In this video we will study about following gram-positive bacteria: Staphylococcus aureus, Clostridium difficile, Listeria monocytogenes, Enterococcus faecalis, Bacillus anthracis, Streptococcus pneumoniae, Clostridium tetani, Streptococcus pyogenes, Corynebacterium diphtheriae, Bacillus cereus. 1. Staphylococcus aureus. Disease: staphylococcal infection. Signs and symptoms: skin infections, abscesses, pneumonia, food poisoning. Mode of entry and exit: entry through breaks in the skin, exit through wound drainage. Transmission: direct contact, contaminated surfaces, food. Treatment: antibiotics like penicillin, drainage of abscesses. Prevention: hand hygiene, wound care, avoiding sharing personal items. 2. Clostridium difficile. Disease: Clostridium difficile infection (CDI). Signs and symptoms: diarrhea, abdominal pain, fever. Mode of entry and exit: entry through ingestion of spores, exit through feces. Transmission: healthcare settings, contaminated surfaces. Treatment: antibiotics like vancomycin or metronidazole, probiotics. Prevention: hand hygiene, environmental cleaning, judicious antibiotic use. 3. Listeria monocytogenes. Disease: listeriosis. Signs and symptoms: fever, muscle aches, nausea, diarrhea. Mode of entry and exit: entry through contaminated food, exit through feces. Transmission: contaminated food, especially unpasteurized dairy and deli meats. Treatment: antibiotics like ampicillin or trimethoprim sulfamethoxazole. Prevention: proper food handling, pasteurization, avoiding high-risk foods during pregnancy. 4. Enterococcus faecalis. Disease: enterococcal infection. Signs and symptoms: urinary tract infections, bacteremia, endocarditis. Mode of entry and exit: entry through mucous membranes or wounds, exit through feces or urine. Transmission: healthcare settings, urinary catheters, contaminated equipment. Treatment: antibiotics like ampicillin, vancomycin, or linezolid. Prevention: proper infection control measures in healthcare settings, catheter care. 5. Bacillus anthracis. Disease: anthrax. Signs and symptoms: cutaneous, pulmonary, or gastrointestinal symptoms depending on the route of exposure. Mode of entry and exit: entry through skin, inhalation, or ingestion, exit through lesions or secretions. Transmission: contact with contaminated animals or their products, bioterrorism. Treatment: antibiotics like ciprofloxacin, doxycycline, or penicillin, along with antitoxins. Prevention: vaccination for at-risk populations, proper handling of animal products. 6. Streptococcus pneumoniae. Disease: pneumococcal disease. Signs and symptoms: pneumonia, meningitis, sepsis. Mode of entry and exit: entry through respiratory droplets, exit through respiratory secretions. Transmission: close contact with infected individuals. Treatment: antibiotics like penicillin, cephalosporins, or macrolides. Prevention: vaccination, good respiratory hygiene, avoiding close contact with sick individuals. 7. Clostridium tetani. Disease: tetanus. Signs and symptoms: muscle stiffness, lockjaw, difficulty swallowing. Mode of entry and exit: entry through wounds contaminated with spores, exit through feces. Transmission: contaminated soil, puncture wounds. Treatment: tetanus immunoglobulin, antibiotics like metronidazole, supportive care. Prevention: vaccination with tetanus toxoid, wound care. 8. Streptococcus pyogenes. Disease: streptococcal infections. Signs and symptoms: strep throat, scarlet fever, impetigo, cellulitis. Mode of entry and exit: entry through respiratory droplets or breaks in the skin, exit through respiratory secretions or wound drainage. Transmission, close contact with infected individuals. Treatment, antibiotics like penicillin, amoxicillin, or cephalosporins. Prevention, hand hygiene, avoiding close contact with infected individuals. 9. Corynebacterium diphtheriae. Disease, diphtheria. Signs and symptoms, sore throat, fever, difficulty breathing, characteristic pseudomembrane in the throat. Mode of entry and exit, entry through respiratory droplets, exit through respiratory secretions. Transmission, close contact with infected individuals. Treatment, diphtheria antitoxin, antibiotics like penicillin or erythromycin. Prevention, vaccination with diphtheria toxoid, maintaining high vaccination coverage. 10. Bacillus cereus. Disease, Bacillus cereus food poisoning. Signs and symptoms, nausea, vomiting, abdominal cramps, diarrhea. Mode of entry and exit, entry through ingestion of contaminated food, exit through feces. Transmission, improperly cooked or stored food. Treatment, supportive care, usually resolves on its own. Prevention, proper food handling, refrigeration of cooked foods, reheating leftovers thoroughly. Thank you. Meet again next video.